Mr. Joseph. My name is Judine Alexandre, and I'm your occupational therapy assistant. How are you feeling today?
Good.
Good? Okay, so today I'm here to measure your range of motion. So I'm going to use this device. It's called a goniometer, and I'm going to ask you to lift up your right arm so I can measure your shoulder. First, I'm going to palpate to make sure everything feels okay. Are you in pain or are you good? Okay, perfect. So I am going to place the axis of the goniometer at the center of the humeral head, which should be around here next to the acromion process. So on the count of 3, can you please lift up your arm slowly so I can measure your range of motion? 1, 2, 3. And also try to get your arm a little bit closer to your trunk. Okay, so let's do it again. 1, 2, 3. Slowly. So is this your limit?
Yes.
Okay, so that is 100 and actually a little less. So that is about 106 degrees. Okay, thank you very much, Mr. Joseph.
Thank you.
Hello, Mr. Joseph. So we are going to, continue. I almost lost my balance. Continue with passive range of motion. So what I'm going to do is just hold your arm and I'm just going to guide it. So you're just going to follow me as I'm guiding your arm. I'm just going to hold you at around your wrist and also add some support around your elbow joint. So at the count of 3, I'm just going to lift up your arm and then you're just going to stop until, you can't get any further. So, okay. So 1, 2, 3, I'm sorry. So. That be it? Okay, great. And then I'm just going to bring your arm down. And then for assisted active range of motion, so basically you're going to be the one bringing your arm up, but I'm going to also guide you. So the count of 3, we're just going to lift up your arm while I'm going to follow you as you're lifting up your arm. 1, 2, 3. Okay, good, Mr. Joseph. So you can put your arm back down. And then the last one, just want to show you a technique for self range of motion that you can do. So it's you would bring both of your arms together and then bring your hands together and then you can lift both arms up and then bring it back down to your knees, and you can do that 20 times. So if you're at home, you want to exercise, you can do this 20 times. Same thing. Yeah, so that's it. So for passive range of motion, active assisted range of motion, everything that I did here. So what to consider would be if the person obviously is in pain and their functional limitation, and also making sure that we palpate and make sure that the end feels normal. Also in terms of precaution, we would make sure that this person again is doesn't have any injury where they probably dislocated their shoulders or fractures where we wouldn't be able to do certain movements. And lastly, we would just write down the range. So active range of motion, right arm, passive range of motion, right arm, and then indicate the degree. So and I think that is it. So, Mr. Joseph, now I'm going to measure your strength, your arm strength on your right arm. So we're going to do manual muscle testing. So what I'm going to ask you is we're actually focusing on the elbow So I'm gonna ask you to do like so. Put your elbow in the flexion. Okay, and keeping it at a 90 degree. Actually, you can leave it like this. And what I'm measuring is seeing that you're able to do this against gravity puts you at a 3. So now I'm gonna apply resistance so I can find out if you are how much resistance you can take. Sorry. So I'm gonna stabilize with my hand around the shoulder area and apply pressure at the bicep area. So I'm gonna count up to 3, and first I'm gonna apply minimal pressure and moderate and then maximum. So I'm gonna start now. Okay, and don't push down. You have to resist as I'm doing it. Bless you.
Thank you.
So again, now it's gonna be a little harder. Okay, good. And last. So he's definitely a 5. So you can put your arm down. Now I'm going to test your hand strength. So we're gonna pretend that the remote control is a dynamometer. So you're gonna hold it like so and press it as hard as you can. So I'm just doing a demonstration because there would be numbers to indicate like how much strength he has. So I would give the patient the dynamometer and ask the patient to squeeze as hard as they can, and then I would just read where the red needle stops, and then I would write it down, and then I would do it 3 times. Actually it's one hand. Sorry, I don't know why I did both hand. So we're actually looking at the right hand and the left hand. So I would do it 3 times on the right hand, and then 3 times on the left hand. And then I would just look at the red needle and read it. So that's for the dynamometer. I'm struggling saying this word. And the next one, obviously I don't have the device. I'm using my iPod. So I would want to measure for his strength. So finger strength. So we would do the lateral strength and tip to tip and 3 fingers. So lateral strength. Actually, let's do tip to tip. So you just have to do this. I think it's easier. Okay. And then the 3 finger like so. Okay. And then the lateral like this. So this finger is like laterally on the side. Okay, and then same concept as the dynamometer. We would look for the red needle, and then we would be able to read. So that's it for manual muscle testing and pinch and grip strength. So for modalities, we want to start by asking the patient a few questions and making sure that he doesn't have any sensation problems, because obviously we're going to be putting a cold pack and a hot pack, and we want to make sure that if he's feel like it's too cold or too hot, he's able to tell us. So for the hot pack, normally you put in between 2 layers. So there's like a towel on top and a towel at the bottom. And so I'm using this brown towel, and then the hot pack would be in between. And then you want to add 6 to 8 layers on top of the arm. So those towels are, obviously for the hot pack to prevent that, the patient gets burned, but also if there's any leakage, so it could absorb the water. And also we would come and check every 2 to 5 minutes for 10 to 15 minutes. And also for the cold pack, you don't necessarily need to put another towel on top. You could put the ice pack on the arm, but just make sure you have a towel underneath. And I have the patient laying down on a supine position, and I would be standing up. And basically the hot pack and the cold pack helps for, if you have any like muscle stiffness and pain. Hot pack, for edema. Actually cold pack for edema helps with inflammation, and then the hot pack more to help with the circulation, or if there's a particular area that's hurting. Hi, so Mr. Joseph is in a supine position. I'm going to perform a transfer from supine to sit. So I'm going to make sure that I have a broad stance, and also that my body is straight, and that I try not to twist around my waist, and I have a slight bend in my knees. So first, Mr. Joseph, I'm going to ask you to bend your knees for me. And I am going to grab this arm and then put it across your body. Okay, perfect. And if you're able to apply pressure when I'm going to roll you over, please do. If not, I'll use this shoulder and then this hip to help you with sitting. But for now, I'm just gonna grab this shoulder and this hip just to roll you over. So let me make sure I'm positioned correctly. So at the count of 3, I'm gonna roll you over. 1, 2, 3. So now you're in a side lying position, which is great. So with gravity, if let's say the person cannot push, gravity would kind of help me to move him along with me holding the bottom shoulder. So I'm gonna place my left hand around the shoulder that's pressing against the bed, and my right hand is against his hip. So the count of 1 to 3, I'm gonna ask you to lift, to apply some pressure on that hand so I can put you in a seated position. So 1, 2, 3. So this is perfect. So I'm gonna place myself right in front of him. So I'm gonna wanna bring him closer to the edge of the bed. So to do so, I can either hold him around his short, around the hip area, and then, or I can put my hand underneath his butt around the ischial tuberosity, and then just try to move him closer to the edge of the bed, like so. And then just make sure I'm in front of him in case, to prevent any falls or if he loses his balance. So with this concludes the competency exam. Thank you.